So welcome to the Aurora Health Alliance topical webinar, Safety in Accessing Healthcare. I'm Mandy Ashley. I'm our Executive Director, joined by Joe Glaviano, our Program Manager, and Bobby Merrill, our Communications Director. Today, we have two speakers joining us to talk about knowing your rights when accessing healthcare and what organizations can do to help patients feel safer. I'll broadly say in these times, especially with immigrant communities. So, our first speaker today is Harry Budisidharta, the in-house counsel at Aurora Mental Health and Recovery. Harry has a bachelor in arts in political science from California State University, Los Angeles, and his Juris Doctor from University of Colorado Law School. Works with government officials and community organizations to address health disparities in the refugee and immigrant communities. Thanks so much for being here, Harry.
Thank you, Mandy. Thank you, everybody, for having me here. Yes, I'm just gonna put the usual legal disclaimer. I am a lawyer, but I am not your lawyer, meaning that I cannot give you legal advice, but I'm certainly happy to help you and consult. So here is my presentation. So let's start with legal updates regarding healthcare, okay? So part of my job is trying to keep up with the latest development in the legal landscape, which essentially means I have to doom scroll all the time and try to figure out what's going on the last minute. It's really great for mental health. But so January 2025, when Trump administration first took office, one of the first things they did was rescinded the sensitive locations memo. So in the past, they were not prohibited, but they were strongly cautioned against conducting immigration enforcement at sensitive locations. These are places like healthcare clinics, schools, churches, community festivals. ICE can still do those in the past, but they had to go through many layers of approval, so it was extremely rare for us to hear it. Unfortunately, with the rescission of that memo, it means that there is no such prohibition in place, which is why we are now hearing stories about ICE enforcement happening at healthcare clinics, churches, some festivals, and at various other sensitive locations. One of the biggest developments that we had, July of last year, CMS, Center for Medicare and Medicaid, entered into information exchange agreement so that they can share personal data with ICE. This was quickly filed, 22 states quickly filed a lawsuit, and the court issued a preliminary injunction, meaning that they basically put a stop to it in August of 2025. However, unfortunately, in December of 2025, the court narrowed the scope of their injunction, meaning that they are allowing CMS to share some Medicaid data with ICE. So what can CMS share with ICE? They can share data regarding individuals who are not lawfully present in the US, and they can share citizenship, immigration status, address, phone number, date of birth, and Medicaid ID. CMS is not allowed to share health information. So things like treatment, diagnostic notes, doctor's notes, they cannot share that. They also cannot share data regarding people that are lawfully present in the US or US citizens. In situations where the records are mingled and there is no way to separate the records of the US citizens versus people that are not lawfully present, then the court instructed CMS that they cannot share the record at all. So that's one of the limitations. As you can imagine, this has created a lot of fear and confusion in our community. I mean, it's hard for us as a healthcare provider because we take our patients' privacy and confidentiality very seriously, but we are required to collect some data, and we are required to pass it along to HCPF in our case, and then HCPF pass to CMS, and then what CMS do with their data, we have limited control. So this is definitely a developing situation right now. There are 22 states that are still in this lawsuit litigation with ICE. And if there's any further update, I'm sure that I'll be back here and give you some more updates. But this is the current landscape about data sharing. Another thing that you also want to keep an eye out for is the public charts rule. So what is public charts? Public charts is an old rule. This is actually an old immigration rule that has been around, I want to say, since the early 1900s. And it's an individual that is likely to become dependent on government subsidies. So usually this has been interpreted very narrowly. So it's basically people that have been institutionalized for long-term care. This rule is important because if USCIS, if the main immigration agency deem you to be a public charge, they can actually use that as a reason to decide that you are not admissible to the US and that you cannot apply to become a lawful permanent resident, a green card holder. Trump 1.0, so in his first term, he did attempt to expand the public charge rule. There was a lot of lawsuits. It created a lot of fear, and we definitely saw a sharp decrease in the number of immigrants and refugees that are accessing healthcare or applying for government benefits. We expect the same thing to happen because as of November 2025, Trump has proposed more changes to the public charge rule. That basically what they're trying to do is they want to add more categories that can be considered to be public charge. So means tested public benefits, so the use of SNAP or EBT, that in the past has never been actually considered to be a ground for public charge. They would like to actually start using that as one of the criteria that they can use to decide if somebody is a public charge. And it doesn't matter if you use it in the past and for however long period of time. So for any length or duration of time in the past or future. So what does that mean? It means that there is no clear regulations about public charge. Now keep in mind that right now, this is a proposed rule. So when government proposes a rule, they have to give notice to the public. The public has 30 days to comment. After that 30 days period, the government is then supposed to consider the comments, and then that's when they publish the new rule. We have not seen the new rule yet. And because the new rule has not come out, the old rule is still in effect right now. But we fully anticipate that the administrations will adopt most, if not all, of the changes that they are proposing in the new rule. So this will create a lot of arbitrary and possibly discriminatory decision-making by immigration officials. Because now, instead of having this tool that only has like limited, narrow guardrail, they have this much broader scope of what they can consider to be public charge. And, means tested public benefits, you use it in the past for a week, a month, a year, doesn't matter. They can use it. There's even questions right now of, well, if you can consider any use that happened in the past, what about the use that was, quote, allowed under the old rule in the past? Is that going to be a negative factor for public charge now? And the administration, of course, has not issued any guidance or clarified that statement at all. So we fully expect that there will be the combination of this public charge rule along with the data sharing with ICE. We fully expect that that will create a lot of fear and confusion within the immigrants and refugee community. Yeah. So these are data that I have pulled from Colorado Sun. So just impact on our clients so far, right? So beginning in October of this year, because of HR 1, the One Big Beautiful Bill, refugee and asylees will no longer be eligible for federal insurance program. We expect about 7,000 lawfully present immigrants to lose their coverage. We expect around 375,000 people also impacted under the mandatory work requirements. So I think we as healthcare providers certainly have our work cut out for us because now we're going to be seeing a lot less people coming for our services. In addition to that, we also have to consider what is the impact on our staff as well, because back in January, during the height of Operation Metro Surge that was taking place in Minneapolis, one of the most common questions I received from our staff was, what do we do if ICE comes to one of our facility? What are the steps if they force their way in, or if they grab a client, or if they demand records? What do we do? So this is definitely a challenge for us to address. So here are some of my recommendations on proactive steps that each of you can take. Number one, it's very important to review and update your policies and procedure. Each of you work in very unique facility with unique building layout and unique workflow. So, but you must have that discussion with your management about what is the procedure if an ICE agent shows up at your facility. What's the procedure if they show up and they ask for a client's record? Which part of your facility is public and which part is private? This will be important because if it's a public area, law enforcement, including ICE agents, can enter without a warrant. But if it's a private area, then they will need a warrant to enter the facility. Here are some resources that I've pulled to help all of you. These are all public information, so you could click on it, and there's a sample policy template created by medical associations in California. There's also ACLU guidance on questions and considerations. Here is a sample actually from Aurora Mental Health. As we know, we could create the best policy and procedure, but during times of stress, I don't think it's reasonable for us to expect our frontline staff to read through like 5-6 pages or to remember, right? So we created this flowchart to keep it as simple as possible. So, and really, what we emphasize with staff is that the top right-hand corner of the document, contact information. This is where I put my name down as the in-house legal counsel, and also a backup person, so that way staff knows, like, we have an ICE agent shows up, or we have Denver Sheriff, or we have Aurora Police shows up and they're starting to make demands. I need to call one of these two people so that they can be the one that reacts directly with the law enforcement. We find that this is actually very helpful to staff. I think staff feels very reassured when they know that there's that firewall between them and law enforcement. They are trained to say, I'm sorry, I cannot answer your questions. That is against our policy. Here is the phone number of our in-house counsel. Please give him a call and he will talk to you. And that has worked beautifully within our organization. Like the police basically, knock on wood, we have not had any visit by ICE agents. But when police comes, they just basically call me and then I talk with them. And the vast majority of the time, the visits are very much harmless visits, right? They're visits because they want a copy of surveillance camera because, there was a carjacking that happened in the neighborhood last night, or they want to drop off a subpoena for something. It's very innocuous visit, but it still helps reassure staff knowing that, hey, just give them this phone number, then we'll take it over from there. Don't worry about it. And please feel free to take this flowchart and then just modify it to fit your organization. Like none of this is confidential information. Okay, staff training. We talk about policy and procedure. Training is the most important. For those of you that have multiple buildings and multiple teams, I'm sure that everybody has different workflow and different layout. We met individually with each of our team and kind of like go over their workflow, their concerns, figure out what we can do to help them. Because our staff that works, even staff that works in our building, some of our staff works in building where we are fortunate to have a locked door and we have like an intercom system where we can screen people. But we also have staff that works in our 24/7 facility where it's just open all the time and people can go in and out because that's the nature of the services. We also have staff that are out in the community. They are visiting clients' homes or they are at library or churches. Those are unique challenges that they have, but we met with them and then we go over, okay, If you are at a client's house and police or ICE showed up, this is what you should do. Carry my number, carry this card, give it to them, and then let us talk with them. Here are the resources. So Know Your Rights card. These are cards about the size of a wallet. It's meant to be kept in your wallet. It's basically a list of the rights that you have, regardless of your immigration status. So everybody here, as long as you are in the US, you have the rights to remain silent, the right to not consent to a search, the right to ask for an attorney. So those cards are useful just as a reminder for everybody of like, hey, when you deal with law enforcement or ICE, you still have all of these rights, and just remember to affirmatively say that you have those rights. It's not enough to just stay silent. You have to say, I want to remain silent. I want a lawyer. I do not give you permission to search my car or my purse. Family preparedness packet. That's actually a document that I recommend everybody fill out, regardless of your position or your immigration status. It's just a really neat document that basically where you go over with your family and then you designate, okay, in the event that I'm arrested or I got into an accident and I'm in a hospital, and or I fell sick and I'm in the hospital and you cannot talk to me. Here is bank information. Here is school information. Here are the emergency contact. Here's information about paying debt, online access, everything. So this way, if you become unavailable for whatever reason, your family or your friends can help pick up the pieces and make sure that things remain smooth while you are recovering. That's actually the last of my slide, and that's my contact information. Obviously happy to answer any questions, anything. You can raise your hand, or Allison, you can go next.
Our next speaker is with Stride Community Health Center. Allison Draayer is a licensed clinical social worker to start, but how far down the list should we go?
Don't go
Allison
far.
is the
It's
Vice
not worth it.
President of Public Affairs and Business Development, is a professor of community health, a staple in leadership in the community, and always willing to answer my texts, even though she's on spring break with her family. Sorry, Allison, and thank you so much for coming back and being here.
Yeah, yeah. Well, and honestly, I really I really appreciate Harry's presentation. I think that it was really super comprehensive um and actually hit on a lot of the points that I have too. So some of this is just going to be reiteration of what Harry said. But I think that the context is really important, that a lot of us are dealing with some constraints legally, that we have to follow the rules, especially as, places that get federal funding. We do need to follow the rules. And as much as we, want to support patients, we have to make sure that everything is by the book. And I do think that it's really important, not only for the communities, but for staff to understand that the policies and procedures that you put into place are for a reason. They're obviously to protect the patients, but they're also to protect the organization, so that we can keep providing services to patients. Right. So, I really appreciate what Harry kind of said about, staff, that the impact that this has on staff, that they want to protect themselves, protect the patients, protect the organization. And, the very first thing that people were telling me when all this was coming down the pipe was, well, we're just going to bring everybody back really fast. And I was like, no, 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 no. Like, we have to follow policies and procedures to make sure that we do this in a way that is compliant with the law, that protects our patients first and foremost. So all of those documents that Harry provided, are really great for everybody to have within their own organization, and to inform patients that we have in place. We have our own. It's a contact sheet. I actually made it really robust. That it's not just what to do if law enforcement comes in, but also what if media comes in? Because media is a big part of this right now. That they want a news story. So if your organization has a different media contact from a different legal contact, or if it's one of the things that happened at Stride early on was we had police enter into the building, but for a completely different reason. And so it's really important that staff know the right questions to ask so that they know specifically, like we don't raise high alert for something that isn't actually happening, right? There's no reason to cause concern and to alarm patients if it's not for something, it was completely a different situation. And so it's really important to give your staff the information so that they can stay calm and they stay informed, and also to let them know that this is you know eh, not something that they have to deal with by themselves, right? That we organizationally are dealing with this. So I just want to echo how really important it is to make sure that you're constantly talking about this. Like obviously it happened about a year ago that this all started coming down the pipe, and I'm realizing like, oh, I need to update and retrain on our forms, right? Actually, in the next over the next couple of weeks, our HR department is going to do a reintroduction to staff, to make sure that it's fresh in their brains. So it's not something that you have to do every single week, but we talk about it in new employee orientation, just so that their patient or sorry staff are aware. But also we just have to do like a refresher every once in a while. So I just sent out about a month ago our contact information, right, of who to contact in what instance, right? Um, in terms of patients, one of the things that we're really seeing is that patients are scared to come in for care, right? And so for one reason or another, right? And so one of the things that we've been doing is just really being robust about the telehealth opportunities that we offer. So we don't want to limit care access, and so we're really trying to let patients know that telehealth is always an option, regardless of your situation. It's an option for all of our patients. We're also, staying up to date on current practices. I really love that Harry started off with what's going on with Medicaid at a federally qualified health center. We don't collect that information unless you're applying for some sort of state-based or federal program. So, if for our self-pay patients, that's just not something that we collect. So we let patients know that that's not something that we're gathering information for, but anything additional is part of their health record, which again, as Harry explained, that's in a separate category of its own, right? And so, a couple other things that I have, again, Harry went over a lot of this. Um, another thing that we do, we don't have the cards in our lobby, but we do have resource guides that a lot of our staff have access to, specifically our care coordinators and providers. They have access to resource guides so that they can go to the experts, right? We're not going to be experts in all of these areas, so it's really important that we are referring patients to where experts are. So I think having a really robust resource guide is important, that you kind of keep up to date as things are changing, because things are always changing, right? Especially when it comes to community organizations. And then we're also staying really connected with our primary care association, who has a more of a national lens. So one of the things, I was in DC a few months ago, and obviously whatever happened in Minnesota, we're trying to glean whatever happened, like the best practices that they learned. Unfortunately, they had to go through it, and so we're trying to glean from them what can inform our practices. And so they're in the process of compiling some information that we can utilize to better inform our practices here. Um, yeah, and so I think that. Oh, and then the other thing is just really making sure to designate space. I think that space is the really tough one that we're facing right now. What's public, what's private, anything that is where a patient has to be admitted back to or like taken back to. We have a sign on all of our doors that says that. And it's still something that it feels a little bit nebulous to staff, but we try to make it as clear as possible. And another thing that we're preparing to do is actually a walkthrough. So I love Harry's workflow that he showed us. I think that that's really important. But the other thing is like doing real walkthroughs with people. We found that that was the feedback that we've gotten and that we're implementing in the next couple of weeks is actually walking our front desk staff through that. Sometimes actually doing it firsthand makes them feel a little bit more at ease. Obviously, if they get put into a situation where any law enforcement or authority comes in, it's going to be anxiety provoking. But the more that you can like just kind of run through it of, hey, this is exactly what you say in those situations, and then you're going to call and you're going to call your supervisor and blah blah blah. The more you can walk through it, I think that that's also super important. Um, so yeah, that's all that I have. And I don't know, Mandy, if you want to turn it over for some questions.
Thanks, Allison. Thanks, Harry.
So Bruce in the chat asked questions about how can we tell the difference between administrative warrant versus judicial signed warrant. And that's a great question because that is definitely an issue. And of course, by the end of this presentation, I expect all of you to be an expert in Fourth Amendment, right? Yeah. So a judicial warrant, the easiest telltale is that at the top, it says United States District Court. And then on the bottom, it's signed by a judge. This is different than an ICE warrant, because if you look at an ICE warrant, what they say is Department of Homeland Security at the top. It doesn't say U.S. District Court. It says immigration detainer, and it's not signed by a judge. It's actually signed by a supervisor in their field office. We are not required to comply with this. No individual, corporation, organization are required to comply with this. This is also another example of an ICE warrant. And again, at the top, it says U.S. Department of Homeland Security. It says warrant, but it's not signed by a judge. So the key part is why we emphasize judicial, because if it's a court, we have to follow, right? If it's a court and they actually show up with this, then we basically step aside and then just let them do what they need to get done. I have talked with a lot of my friends who has done this immigrant rights work far longer than I have, and not a single one of them ever remember an instance where ICE actually shows up with an actual judicial warrant. They usually show up with this detainer or this administrative warrant. And that's because judicial warrants are not easy to get. You have to submit an application, you have to submit to the judge, and then you have to talk to the judge, explain why, and then the judge may or may not give you. That takes time. Whereas the detainer, you fill this out, you probably walk down the hall or take the elevator in your building, and then your supervisor sign off on it. Then you're done. And that's why when people ask ICE agents, do you have a warrant? 99% of the time, they'll show you this document. They said, yeah, we have a warrant. See, it says warrant. But unless you know, you do not have to follow this. Yeah, and I did check with friends that are immigration lawyers. No, there's no requirement for us to follow that at all. Unless your organization has a policy of actually following that, right? I'm not sure why you would have that policy, but if you have that policy, then yes, you would follow it. So now let's talk about the practical reality, right? Because that was my legal answer on that one. Practical reality. Ever since Minnesota, what we have repeatedly emphasized with our staff is that their safety and well-being is our primary concern. If ICE agents show up with a warrant that is we do not have to follow, maybe it's written in crayon, written on a piece of a napkin, during their lunch break on the back of a restaurant menu. Mm-hmm. You don't have to follow. But the ICE agent is right there in your face, and they move you aside or they shove you away. We tell our staff, please do not try to get in between. Just step away, move away from there. Let me be the one that deal with them, right? Because the last thing we want is staff member to actively, physically intervene or try to block access. The moment you do that, they will have probable cause to basically take you down to the ground and then arrest you and charge you with interference. And we do not want that to happen to any of our staff. So that's the reality, right? Legal, you have to follow. They force their way in, please prioritize your safety and well-being. Just step away. We will deal with it, right? We can replace broken desks. We can replace broken computer monitor, whatever. That's easy. We don't want our staff to get hurt.
Great advice.
One point that I also want to point out too is in Harry's workflow that we've also talked about is videotaping. That's also come
Yeah.
up very in every training that we've looked at or every workflow is videotaping. I know that some staff are like, well, we have like a policy on videotaping. I think that this is like a little bit of a different situation. And so I think that it's important to clarify that in those situations, if you're like, no, I give you permission to videotape this entire process, just to make sure that's okay.
We have questions.
Joe.
Yeah, I have a question. So at the beginning of your slide deck, Harry, you mentioned that CMS may share the following information regarding individuals and their status, et cetera. So my question is
Yeah.
that may share information. Does that mean that we expect that CMS will just be required to automatically share information when they get a new patient, for example, who does not have documentation? They just are automatically going to be needing to share that, or are they going to be asked to share at certain points of time? Like, what does that look like?
I'm afraid we do not know the actual steps on that piece. I think a lot, honestly, will just depend on who's in charge of CMS in that particular record section and how compliant they want to be. I can easily see instances of CMS agents proactively be like, here you go, here's a list of 10,000 new names you have, eyes, enjoy. Or maybe you have somebody that's more like, we will not share until ICE actually make a request. But I think that's a little bit unknown at this point.
Thank you.
So, Rich, at Stride, what we do is it's on all of our locked doors. Like any door that has like a badged entrance that somebody has to. It's really hard to enforce in like lobby areas. And so at like La Plaza, that since I was there with you, I know what you're talking about. It's really, really hard to enforce where there's like big, large lobby areas or places that people can go without an appointment, right? Like I can have people walk into our lobby area and request an appointment on the same day. I don't have like a guard at the front door asking people that sort of information. And so I think that it's that where we've drawn the line is like anything that's like a door where you need a badge or you need a key or something like that, so like when we call our patients back, we can take them back into a room where they have authorization to be there, if that makes sense. So that's kind of the differentiation that we've done. It's a little bit harder to do with those like large public spaces where anybody could theoretically walk in. I think that and Harry can correct me if I'm wrong, but I'm going to step out on a legal limb here and say that private property signs is like if I called the cops and said I want this person removed from my property, then that's like a little bit more of that private property differentiation. But I'll let
Yep.
Harry correct me if I'm wrong.
No, no, that's exactly right. Yeah. I mean, any of those semi-public areas like the lobby, it's hard to enforce because people can come in and out, right? I mean, we've done this presentation for churches as well. And I know that for a lot of churches and mosques and any other religious places, this is a bit of a philosophical debate that they need to have because a lot of their spaces are designed to be public, to be open, to be welcoming. But by that very nature, anybody can just walk right in without any warrant. So that's the debate they need to have internally. And there's no right or wrong answer, right? I mean, if you want an open space, by all means, please have it because that's the nature of your place. A place that is absolutely, completely 100% secure, those are called jails. Those are the most secure place you could have.
Any other
And
questions?
Mandy,
Go ahead.
yeah, I'm afraid I don't know the answer to your questions about the Omni Salute. I mean, I know
We
that
have
the
a
state
bunch
of
of
Colorado is,
brilliant minds here. Is
yeah,
Omni Salute going forward? Do we know?
So I think that the last that I've heard is that that they're capping kind of, right? They're capping how many patients are able to do it. I haven't heard that it's going to be terminated entirely. I mean, honestly, a lot remains to be seen. Um, in November, right? Like I
Yeah.
think that everybody's kind of waiting with bated breath to see what happens in November, and to see what programs continue, how things shift, all that kind of stuff. I think that a lot of us are kind of at the mercy of votes and and that kind of situation. So as far as I've heard right now, no, but it is pretty condensed.
And it does not omnislu the insurance option for undocumented or uninsured folks, undocumented folks, doesn't include any federal funding. So I would imagine that that is not an option for ICE to pilfer more information about patients, but can look that
Oh,
up
it's,
and follow
yeah.
up with after this too.
Yeah, I think that's something we have to ask OmniSolute because they would know best regarding
Yeah.
what is it that they're required to share versus not required. But following on that point, I put in the chat earlier about grants agreement. This is also an area that all of you will want to be careful about because last year, around May or June, we started seeing very nasty provisions inserted into various grant agreements, especially federal grant agreements. I mean, we were seeing, for example, for our victim service department, we were seeing sections there being put that says you must cooperate with immigration enforcement activity. No idea what that means. Does that mean that we have to share data? No idea. They even put in a section that says when you do public presentations about domestic violence, you cannot talk about it as if it's a systemic or gender issue. It is an individual issue, and that's how you have to address it. So they even wrote that into the grant agreement. Fortunately, the court also put an injunction into those. So a lot of those new terms were not going into effect. But we're starting to see that happening as well with a lot of our HHS grant, especially starting from last month. We're starting to see more of that provisions coming in, regarding care for transgender community members, regarding, abortion. We start seeing a lot of those sections as being put into all sorts of grants, even if there's no relevance to it. So just make sure that you review all of those. And we definitely have advised all of our staff, like, I don't care how small the grant is, if it's from the feds, you have to have us review it.
Mm-hmm. That's great advice.
I would say, I think my closing remark is just that, yeah, I mean, all of you are doing such good work in the community. I mean, I am very fond of our frontline staff, the ones that are providing this direct service. And I know that they are really struggling. They are hurting quite a bit, because they see the effect on their clients. They have their fear when they go out in the community. So thank you for being part of this call. Please reach out to your staff, see what they need, what resources. Feel free to contact me, contact us. We'd be happy to be your resource and, run through scenarios with you. Because we are trying to, just like all of you, we're trying to make sure that this infrastructure remains in place so that we can continue serving the community. And without our staff, there is no infrastructure.
Yeah, I think that's a perfect way to end it. I think my only other thing is um that this is a really challenging situation. I think that when all of us are working with underserved communities, much like how COVID was, right? It's uncharted waters, and we're all just doing the best that we can with the information that we have. And so I think that it's really important to um, have grace for people as well as they're navigating this. I think that in anxiety ridden situations, we all like want answers right now, right? And we want to do, and so it's important to stay informed. It's important to make good decisions. It's important to train with the information that you have, adapt when you get more information. And so it's just like it's a process and a continuum that we all have to stay on. And so I think that I would just really encourage people to be aware of that we are all doing the best we can with the information that we have. We all have the same goal of maintaining supports for the communities that we serve. And let's just continue to support one another with the information that we have, so that we can keep doing that.
We're in this together. Thank you all for your information, your guidance. Thanks everyone for joining. Thank you, everyone.
Thank you.